I'm Jack Turban. I'm affiliate faculty at the Philip R. Lee Institute for Health Policy Studies, and I'm also an assistant professor in child and adolescent psychiatry, where I direct our gender psychiatry program that is a clinical program to support the mental health of transgender and gender diverse youth. I also work in the adult LGBT psychiatry clinic, so I'm able to see a lot of trans people across the lifespan from early childhood all the way into adulthood. Recently, I've been really interested in the ways in which public policies impact the mental health of transgender youth. So our research often uses large databases like the US Transgender Survey, which is this data set of over 27,000 trans adults, to look at questions relevant to public policy. For instance, what's the impact of gender-affirming medical care on young people's mental health? Or what are the impacts of conversion therapy or conversion therapy bans on young people's mental health? And I think of my work as involving this research, this clinical care, but also working to educate different populations. So I often will write op-eds to work with major news outlets to make sure the general public knows about these topics and these public policies, as well as their impacts on mental health and why they should contact their lawmakers about it. And working with the courts, so serving as an expert witness when different laws are being challenged, usually by the ACLU, on these questions of whether or not these different laws are constitutional. So if anyone's interested in trans health or public policy research, I would love to talk to them. And also if they're interested in working in these different avenues, so combining things like research, clinical care, working with the media, and working with the courts and lawmakers.